She'd always been the sharpest person in the room. Margaret, 71 years old, a retired school principal from rural Ohio, she remembered every student's name from her 30 years of teaching. She remembered birthdays, phone numbers, and the exact directions to places she'd only visited once. Her family called her the human encyclopedia. Then, over about 18 months, something changed. She started losing words mid-sentence. She'd walk into the kitchen and stand there, genuinely unsure why she'd come. She forgot her sister's birthday for the first time in her life. She was scared, her family was scared, her doctor ordered tests. The tests came back clean, no signs of Alzheimer's. No structural changes in the brain. No tumors. No strokes. So what was happening to Margaret? The answer was sitting in her medicine cabinet. Not one medication, 5, and 3 of them had something in common that nobody had ever mentioned to her. Not her doctor, not her pharmacist, not the insert inside the box. What they had in common was this. They were systematically interfering with the chemistry her brain needed to form and retrieve memories. The day her prescribing doctor adjusted those medications, Margaret described it later as the fog beginning to lift. My name is Dr. Franklin, and this channel exists for one reason. To give adults over 60 the kind of honest, research-backed health information that gets skipped in a 7-minute appointment. Today, I'm walking you through 5 categories of commonly prescribed medications that have significant documented effects on memory and cognitive function in adults over 65. I'll tell you exactly what to watch for. I'll show you what the research says. And at the end, I'll give you a specific conversation framework you can use with your doctor at your very next visit. Stay with me through all 5, because number 3 is the one that shocks people the most, and number 5 involves a medication that millions of seniors take every single night. Assuming it's completely harmless, before we dive in, drop a comment below. Tell me your name and where you're watching from. I read every single one, and I genuinely want to know who I'm talking to today. Before we get into the list, I need to give you one concept, because without it, what follows won't fully land. I call it the aging brain threshold. Here's the reality of what changes after 65. Your brain, like every organ, has reserves. When you're younger, your brain can compensate for interference, a medication that mildly suppresses a neurotransmitter. Your brain reroutes. It adapts. You might not feel a thing, but after 65, those reserves begin to narrow. 3 things happen simultaneously. First, your brain's production of acetylcholine, the neurotransmitter most directly involved in memory, naturally declines with age. Any medication that further suppresses acetylcholine is now pushing against a system that is already working with less than it once had. Second, your kidney and liver function slow down. These are the organs responsible for clearing medications from your body. When they slow, drugs stay in your system longer, sometimes at concentrations far higher than the original dose was intended to produce. A medication designed to last 8 hours in a 40-year-old may linger for 14 hours in a 70-year-old. The cumulative effect builds quietly. Third, and this is the one that genuinely surprises people, the blood-brain barrier becomes more permeable with age. This is the protective layer that filters what enters the brain. In younger adults, it does an excellent job blocking certain substances. In older adults, more gets through. Medications that had minimal cognitive effects at 50 can have measurable effects at 70. Not because the drugs changed. Because your brain did. That is the aging brain threshold. Keep it in mind as we go through each one. Anticholinergic medications, the category nobody warned you about. Let me start with a word you may never have heard, but that your doctor uses often: anticholinergic. Any medication described as anticholinergic works, at least in part, by blocking acetylcholine, the very neurotransmitter we just discussed. And here is the part that stops most people cold when they first hear it. Anticholinergic drugs are not rare specialty medications. They are some of the most commonly prescribed drugs in the world, and they hide in plain sight under names and categories that sound completely innocent. Bladder control medications, prescribed to millions of seniors for overactive bladder, are heavily anticholinergic. Many antihistamines, including ones available over the counter, are anticholinergic. Certain antidepressants, certain medications for dizziness or nausea, and some sleep aids. A landmark study published in JAMA Internal Medicine followed over 3,000 adults over the age of 65. For 10 years, the researchers found that people who used anticholinergic medications for a total cumulative period of 3 years or more had a 54% increased risk of developing dementia compared to those who did not use those medications, 54%, and here is what makes this especially important to understand. The effect was dose-dependent and cumulative. It wasn't one high dose that caused the problem. It was consistent daily exposure, compounding quietly over years. Think about the math: a senior who has taken an antihistamine every night for 10 years, a bladder medication daily for 5 years, and an occasional sleep aid. Those exposures add up in total anticholinergic burden. That person may have been accumulating a significant load for well over a decade without a single conversation about cognitive risk. I want to be clear about something. This does not mean you should stop your medication today. These medications often serve real important purposes. What it means is that you deserve to know this information exists and to have a conversation with your doctor about whether your anticholinergic burden is being monitored and whether alternatives exist. Your action step: ask your doctor or pharmacist about your total anticholinergic burden. There is actually a validated scoring tool called the Anticholinergic Cognitive Burden Scale. A pharmacist can calculate your score from your current medication list. This conversation takes 10 minutes and could be one of the most important ones you have this year. Benzodiazepines and Z-drugs, the sleep medications with a hidden cost. I want to talk about sleep medications, specifically the class of drugs called benzodiazepines, medications like lorazepam, diazepam, and clonazepam, and the related class called Z-drugs, which includes Zolpidem, the generic form of Ambien. These medications are extraordinarily effective at what they do. They quiet the nervous system. They reduce the time it takes to fall asleep. For someone dealing with severe insomnia or acute anxiety, they can feel like a lifeline. But here is what the research shows about long-term use in adults over 65. A study published in the British Medical Journal analyzed data from nearly 9,000 adults. It found that those who had used benzodiazepines long-term had a 51% increased risk of Alzheimer's disease, and critically, the risk increased with longer duration of use and higher doses. Here's the mechanism that makes this particularly relevant after 65. Benzodiazepines suppress the architecture of your sleep. Specifically, they reduce the amount of time you spend in deep sleep and REM sleep, and deep sleep is not just rest. It is maintenance. It is during deep sleep that your brain's glymphatic system, its overnight cleaning crew, flushes out the metabolic waste products that accumulate during the day, including amyloid beta proteins. Those proteins, when they accumulate over years without adequate clearance, are among the hallmarks of Alzheimer's pathology. So here is the cruel irony. A medication taken to help you sleep may, over time, be interfering with the very sleep stages during which your brain protects itself against cognitive decline. You sleep more hours but less efficiently, and the cleaning crew never fully shows up. What to do instead? There is a non-pharmaceutical intervention called cognitive behavioral therapy for insomnia, or CBTI. Multiple clinical trials have shown it to be more effective than medication for long-term insomnia management, with zero cognitive side effects. The American College of Physicians recommends it as the first-line treatment for chronic insomnia. Ask your doctor specifically about CBTI before renewing a long-term sleep prescription. Statins, the cholesterol medications that carry a cognitive debate you've never heard. This is the one that surprises people the most, because statins, medications like atorvastatin, simvastatin, and rosuvastatin, are among the most prescribed drugs in the world. Millions of seniors take one every single day. They have genuinely saved lives by reducing cardiovascular events. So what is the concern? The FDA added a cognitive warning label to statins in 2012, following reports of memory loss and confusion associated with statin use. Most people never saw that label. Most doctors didn't discuss it. It was a quiet addition to a very popular drug. Here is the biological basis for that concern. Your brain is roughly 25% cholesterol by dry weight. Cholesterol is essential to the integrity of neuron membranes, the very structure that allows brain cells to communicate with each other. Statins work by suppressing cholesterol production systemically. They do not know to skip the brain. Additionally, some statins, particularly the lipophilic ones, meaning those that dissolve in fat, cross the blood-brain barrier more readily. Simvastatin and atorvastatin are in this category. Pravastatin and rosuvastatin are less likely to cross. The research on statins and cognition is genuinely mixed. Some studies suggest protective effects against dementia. Others document measurable cognitive decline in susceptible individuals. What is consistently documented is a category of statin users who experience what they describe as brain fog, a subtle but real reduction in mental sharpness, word retrieval, and processing speed that resolves when the statin is discontinued or switched. I am not telling you to stop your statin. The cardiovascular benefits for high-risk individuals are real and significant. What I am saying is this: if you have been on a statin for years and have noticed any gradual change in mental clarity or memory, that you've been attributing to age, that is a conversation worth having with your doctor. Specifically, ask whether switching to a hydrophilic statin like pravastatin, which crosses the blood-brain barrier less readily, is appropriate for your risk profile. Proton pump inhibitors, the heartburn medication and its B12 connection. Proton pump inhibitors, omeprazole, pantoprazole, esomeprazole, are some of the most commonly used medications in adults over 60. They are highly effective at reducing stomach acid and treating acid reflux. Many people take them daily for years, sometimes decades, without any intention to stop. Here is what gets left out of that conversation. Stomach acid is not merely a digestive irritant, it plays a critical role in the absorption of vitamin B12. And vitamin B12 deficiency is one of the most reversible yet chronically underdiagnosed causes of memory problems, confusion, and cognitive decline in older adults. Here is the mechanism. When proton pump inhibitors reduce stomach acid, they also reduce the acid that cleaves B12 from food proteins, a necessary step before B12 can be absorbed. Over time, B12 stores deplete, and unlike many deficiencies that produce obvious physical symptoms, B12 deficiency can present almost entirely as neurological and cognitive changes. A study published in JAMA Neurology found that long-term PPI use was associated with a 44% increased risk of vitamin B12 deficiency. A separate analysis linked low B12 levels to measurable reductions in brain volume and increased dementia risk in older adults. The practical implication is simple and actionable. If you have been on a proton pump inhibitor for more than 12 months, your B12 level should be checked. Specifically, ask your doctor for a methylmalonic acid test alongside standard B12. It is a more sensitive indicator of functional B12 deficiency than the standard serum test alone. If your levels are low, supplementation is straightforward. This is genuinely one of the most correctable causes of cognitive symptoms in seniors. Beta blockers, the heart medications and the memory effect nobody discusses. Beta blockers, metoprolol, atenolol, carvedilol, are prescribed widely after cardiovascular events and for blood pressure management. They are important medications, but there is a cognitive side effect profile that rarely makes it into the appointment room. Beta blockers work by blocking adrenaline receptors throughout the body, slowing the heart rate, reducing blood pressure, quieting the vascular system. Some beta blockers, particularly the older ones like propranolol and metoprolol, also cross the blood-brain barrier and block adrenaline receptors in the brain. The result in some patients, particularly older adults, is a subtle but consistent dampening of what neuroscientists call arousal, not fatigue exactly. More of a flattening, a reduction in mental alertness, processing speed, and the kind of sharp attention that memory formation requires. A review published in Pharmacology, Biochemistry, and Behavior documented that propranolol specifically impairs the consolidation of emotionally charged memories. The kind of vivid, highly encoded memories that are typically the most resilient against age-related decline. Additionally, beta blockers can cause sleep disturbances and vivid dreams, symptoms that disrupt the deep sleep stages we discussed earlier, which are essential for memory consolidation and brain waste clearance. Again, these are medications with legitimate, life-protecting purposes. The goal here is not to stop your beta blocker. The goal is to know that if you have noticed a change in mental sharpness, word retrieval, or general alertness since starting one, that is a recognized side effect and a conversation your doctor should welcome. Specifically, ask whether a more cardioselective beta blocker with lower central nervous system penetration, such as atenolol, might achieve the same cardiovascular goals with fewer cognitive effects. The 4-question cognitive protection protocol. I promised you something you could use, so here it is. The next time your doctor recommends a new medication, or the next time you review an existing prescription, have these 4 questions ready. Write them down. Put them in your phone. Question 1. Does this medication have anticholinergic properties, and have you calculated my total anticholinergic burden? Most doctors will respect you more for knowing that term. A pharmacist absolutely will. Question 2. Does this medication cross the blood-brain barrier, and what cognitive side effects have been documented in adults over 65? You are not asking your doctor to defend the medication. You are asking for a complete picture. Any good physician will welcome that. Question 3. Does this medication affect nutrient absorption, specifically B12, magnesium, or folate, and should those levels be monitored? Proton pump inhibitors affect B12. Metformin affects B12. Diuretics affect magnesium. Many common medications quietly deplete nutrients that the brain depends on. Question 4. If I notice changes in memory or mental clarity after starting this medication, what should I look for and when should I come back to discuss it? This question does 2 things. It opens the door for future conversation, And it signals to your doctor that you are paying attention to your cognition, which means they will too. Any physician who takes your health seriously will welcome every one of these questions. Let me close with this. Your memory is not a passive passenger in your aging. It is something that can be protected, supported, and in many cases significantly improved, simply by understanding what is working against it and making deliberate, informed decisions. Margaret, the woman I told you about at the beginning, did not develop Alzheimer's. She did not have a progressive brain disease. She had a correctable medication burden that nobody had ever sat down and mapped out with her. When someone finally did, the fog began to lift. Her story is not rare. It is documented in the medical literature thousands of times over. And it almost certainly applies to people watching this video right now who have been quietly attributing changes in their thinking to aging, when the real cause is sitting on their nightstand. You have the right to know what every medication is doing inside your body. You have the right to ask whether a safer alternative exists. You have the right to have your cognitive health treated as a priority, not an afterthought. If this video gave you something your last doctor's appointment didn't, please subscribe. I publish research-backed videos like this every week, honest, in plain language, built entirely around helping you protect your health in the years that matter most. And leave a comment below. Are you currently on any of the 5 medications we discussed today? Your experience might be exactly what someone else needs to hear before their next appointment. Take care of yourselves. I'll see you in the next one. Next week, I'm covering the 9 most common medications that could be quietly stealing your memory right now. 1 of them is sold over the counter in every pharmacy in America, and most people take it every single night. You'll want to catch that one.